The people here are great. It's everybody we met, is super friendly, and the food is wonderful.
Pretty waterfront area.
It's very pretty.
Can you tell us your name, where you're from, and why you came to Swiss Medica?
Mark Series from United States, New Jersey. My heart function is low as a result of a heart attack 22 years ago.
What health challenges were you facing daily?
Health challenges?
Yes, yes.
Well, I am trying to improve my heart function.
Did you have any difficulties in daily activities?
No, I'm pretty functional.
Okay, okay. What treatments have you tried before? Did you try anything?
Medications.
Medications. Did you have any improvements with that?
No.
Recently an improvement.
They changed my meds, and the heart function did improve somewhat.
And why did you decide to try stem cell treatment?
Well, I've been reading about stem cells for some time, and it seemed like the only way to actually heal my heart is with stem cells. Meds don't actually heal it, they're just kind of helping it function.
Okay, so did you have any worries about stem cell therapy?
No worries, just, interest maybe. I don't know if you'd say worries. My only worry is that it doesn't do anything.
I understand. And did you talk about your doctor back home about it?
No, I talked to him about stem cells. I didn't talk to him specifically about coming here to have treatments.
And what was his thoughts about stem cells?
He didn't have much knowledge about stem cells specifically. He's probably my age and he's getting ready to retire, so I suspect his interest in learning new and things is waning.
Low. Okay. Were you hesitating about coming to a different country for a treatment? And if you did, how did you deal with that?
When I looked into stem cells, the only place I could get it was outside the United States because nothing's approved. There were some trials I probably could have gotten into in the United States, but they're double blind, so you may or may not get an actual treatment. And at my age and with my heart function, I didn't want to gamble. So I looked into where I could get stem cells.
And why did you pick Swiss Medica out of all the options?
I like the program. I like their approach. Before I was even here, I spoke to two doctors, including Dr. Anna, a few months back to determine whether I was even a good candidate, which meant to me that they were really serious about a program that was crafted for me, not just collecting money to do something.
Okay, can you walk us through your journey with Swiss Medica from talking to our coordinators to getting the treatment?
Sure. Let's see. My first contact was Karen at Swiss Medica, and she was very friendly, and took all my information and then referred me to one of the doctors. I don't believe it was Dr. Anna. I think it was another doctor first, and we had because they had to determine, because my heart function was low, whether I was a candidate or not, and whether they could come up with a program for treatment. The doctor was not a cardiologist. Then they later sent the information to Dr. Anna, who had another video conference with me, and determined that I was probably a pretty good candidate. Even though my heart function was low, I'm still very functional. I'm still able to do everything. So I think that was the deciding factor. And the deciding factor for me was I liked the whole process rather than just, okay, sure, come and we'll...
Yes, understand. And when you came to Serbia, how was the journey here?
The flight wasn't bad. The people here are great. It's everybody we met, is super friendly, and the food is wonderful.
Pretty waterfront area.
It's very pretty. The old city is really quaint. So it's.
So you done some sightseeing,
Not really a lot, because I don't have a lot of time. But we've gone out to dinner every night at a different restaurant, and mostly at the waterfront. And actually we're dining out again tonight.
Nice. Okay, and did you maybe see any improvements or?
Not that I could tell. No, I mean I think it's apparently after speaking to Dr. Anna, we're talking 3 to 6 months before we're really going to see any improvement. So, and for me, improvements are going to have to be objective improvements. In other words, the actual, through an echocardiogram and blood work, we'll have to see if there are
If there are
improvements.
improvements, yeah, understand. Okay. Do you maybe have any advice for others with similar health issues, for example?
Advice?
Advice, yeah, for others.
Do your own homework. I'm very comfortable here. I would recommend this place to someone who needs care. If it's something they can treat. I think the staff has been great. I think the place is nice. We'll see. Hopefully, it'll be successful.
Okay, fingers crossed. Thank you very much.